Good afternoon. Welcome to Facebook Live. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center, joining you on January 5th, 2023, to talk about a few things. So, here's the roadmap for today. So today we're going to talk briefly about just what's going on now, but then I want to take some time just to reflect and review mainly all things health related that happened in 2022. Then we'll do some of our usual shout outs and updates for the upcoming broadcast and what those are going to look like. And that won't take much of your time today, but thanks for taking the time to tune in and or to share this and send this to others for them to take a look at. So let me start with just here and now, brief COVID update. So latest variant is XBB 1.5. What did I see? It's 40% right now in the country. And was it 2 weeks ago? I think it was 10%. So it's really taken off in terms of folks getting it. Good news so far is it's like a lot of these variants, it's not any more severe in terms of how sick you get with it. It is easily spread. And the other thing I think is the current state that more to come, and mainly because it's just hard to get information out of this country, but what's going on with China in terms of their population and their people who have COVID or don't have COVID and how sick they're getting and all that, and what that's going to mean for the rest of the world. Still more to come on that. But from my perspective, that is a current issue in regards to the pandemic. Okay. So I'm gonna turn the page on that and move on. And as always during this, if you have questions, please feel free to send them my way and I will do my best to answer them. So what I'm going to do now is I just wanted to review last 2022 from a health standpoint. And this is by no means a comprehensive list, and it's by no means in any particular order, but I just thought there were some things that were of interest that I would share from last year, just to kind of think about, hey, definitely some stuff happened between 2020 and that year of 2022. So here goes. So first one would be obesity. And this is not a new thing for 2022, but the trend continues. And the numbers that I saw were about a third of those of us in the US are obese, and about 7 in 10 people in the US are either obese or overweight. So that has obviously some significant health ramifications, both physical health wise. We know that if you're overweight or obese, that your risk of cancer, heart disease, and even mental health wise. What did I see when I was doing some research for today? If you're overweight, your lifetime risk of having depression is 50%, 55% higher than someone of normal weight. So there's some correlation there with that in terms of your mental health and your physical health. I think another health-related issue has been supply chain problems throughout the course of this year. I just think in terms of our hospital. Today I was having some phone calls about contrast material for procedures that we do here at the hospital. We got it worked out, but it continues to be an issue. Still, some of the stuff that went back to last summer with General Electric, and they make contrast material, that they're still not up to speed as far as that goes. So contrast material, radioisotopes that we use for stress testing were in very short supply for a few weeks, and that is now over and done with, but that was a good chunk of the month of November. That was an issue. Antibiotics, amoxicillin has been hard to come by. Tamiflu, which people take sometimes if they have influenza, has been in short supply. We've continue to have issues with something called intravenous Ativan, that's what we give patients who are having seizures or who are having alcohol withdrawal type symptoms. So that's been an issue throughout this year. Speaking of drugs, drug overdoses continue to be a significant issue, particularly with a product called fentanyl, which is a synthetic opioid. What did I see? It was so sad. 2021, and I have no reason to believe that this trend changed in 2022. In 2021, 107,000 people died of drug overdoses. And I don't know the percentage that are fentanyl related, but it was a pretty good percentage of that. I think climate change I think the question for most, I'd say the vast majority of science right now and scientists, the question of whether or not climate change is occurring is really not the question anymore. It's pretty well agreed that that is occurring. The question is, how is that going to impact us now and in the future in terms of health and how we go about living our lives? I'm not here to make any further commentary on that, but other than say that is going to define the next decade or decades. And while we're on controversial topics, why not? The overturning of Roe versus Wade will obviously have some health repercussions as we go forward. Once again, I'm not here to have a commentary on that, but just to make the point that that was a significant health-related issue on the, I guess you'd say, the legislative / judicial side of things this year. Another thing that came up this year was the criminalization of medical errors. There was a nurse in, I believe, Tennessee, LaDonda Voigt, who was prosecuted for a medical error that occurred while she was taking care of a patient. She ended up getting 3 years of probation and did not get jail time, but it definitely has had a chilling effect when you read across the medical literature, both nurses as well as doctors, in terms of what is that going to mean going forward for our profession. Physician burnout, depending upon who you talk to, definitely a decent number of our physicians who are experiencing burnout. That continues to be an issue. The next health-related thing, which I think is going to end up being a good thing, is the 988 mental health crisis line, which I think we've put some billboards up about that here around the area. But it's like a national hotline if you're having a mental health crisis. So I think that's been a really positive thing. Continues to be an issue in terms of for 2022 and going forward is physician shortage issues. The American Medical Association threw out a pretty broad range, but they predict within the next 12 years there's going to be between 37,000 and 124,000 deficit or deficiency in terms of the physician supply in our country. Now, I will say that even locally here, we're doing things to try to overcome that shortage. We've done a lot of telemedicine services to link up doctors to patients here in our area, doctors who perhaps would not come and live in this area. Not that I think it's great living here and where we're at, but I'm just saying that that's not always the case. So we've leveraged the teleservices that are available nowadays. So I was looking at a list here. So we've had telepsychiatry here at the hospital for a number of years. We started tele-urgent care, which, by the way, you can access here readily by getting onto a CGH website or the portal, and you can have one of our medical staff, one of our primary care providers see you on tele-urgent care. Thank you, Rebecca or Dana. We are going to reboot up with something called tele ICU. So having intensive care doctors be able to oversee patients who are remote in a different setting. We have teleneurology, both for clinic patients to be seen as well as for hospitalized patients. We have neurologists that we do tele visits with. So a lot of that stuff, and even with your own, a lot of our primary care and specialty physicians still are doing televisits. Some of that's a remnant from the pandemic, and they just have continued to do that. So that continues to go on here. And I think that by and large is a positive way to get physician and nurse practitioner, physician assistant services to patients. Another 2022 item was a polio outbreak, particularly in the New York area. And also an outbreak of something called monkeypox, which is being renamed, I believe, to Mpox. Both of those are outbreaks that were new this year, particularly the polio one. I just wanted to make mention of, as far as that goes. What was it? In the 1950s, I believe it was, or 40s, where the opportunity to get immunized against polio came out. And a lot of the outbreak that we saw in New York was amongst people who had not been immunized and or were around people who had not been immunized. So immunizations over the years have saved millions of lives. So yeah, I know there's a lot of controversy and has been with COVID, and even that has saved a lot of lives. It's just the polio one, just as a reminder that, hey, get vaccinated for these things that we know we can prevent, and we can keep people from getting. You still see folks who have had polio from years gone by, and how crippling that can be, or life-threatening for that matter. And the same for a lot of childhood diseases. Another 2022, from my perspective, news item was this triple-demic of RSV, influenza, and of course COVID that happened over the course of the last couple months. RSV has really cooled down. Flu is beginning to wind down. COVID still doing its usual stuff. But I thought that was a convergence of a lot of stuff there that made things pretty prickly, trying to take care of all those patients during that period of time. I think mental health, and you can put quotation marks around crisis, whatever you want to call it, but mental health needs in 2022 have continued to rise. What did I see here? I think the thinking is it's a combination of pandemic and some social isolation that has occurred as a result of the pandemic, along with, for sure, some social media related anxieties that can occur, having increased the mental health issues. And the fastest growing group for mental health issues are teenagers and young adults. And my commentary on that is that some of we're doing Facebook Live on a social media platform, so I'm not completely saying that these platforms don't have some benefit, but they need to be well thought out and well decided in terms of what exposure you're going to give your mind to. And I think in particular to teenage minds, and our brain may have all the neurons it's going to have by the time you're a teenager, but the development of our brains continues up until young adulthood. That's why it's really important. And when you see teenagers really stuck to that phone a lot, and if that phone that they're stuck to involves social media related items, it's concerning. It really is. And so I don't think that, if we don't pull phones away from young children, but at the same time, for those who are entrusted in their care to have thoughtful conversations and set some parameters around those, because there's no question that they do have an impact on teenage mental health. Okay, so by and large, I've just shared with you what I would consider some not that great news about in 2022. And let's face it, as humans, our minds tend to go to the negative. But I want to talk about some positive things that have continued to surface in 2022. So believe it or not, child mortality or child death continues to decrease even during the pandemic. So the child mortality is down 50%. So by the time you're 5, your likelihood of dying is down 50% since the year 2000, and it's down almost 75% since 1970. So some things are happening in the world, and I would throw in that nutrition, access to clean water, vaccines, all of which have continued to decrease the mortality, is the word that we use, of those under the age of 5. So that is really, really encouraging. Other encouraging things, I'm reading we're continuing to make good progress on a vaccine for malaria. Immunotherapy, particularly for cancer treatments, continues to maybe explodes a little strong, but more and more treatments for patients who have cancers that in the past would have been weeks or months of life. And now patients are getting years of life as a result of those cancer immunotherapies. So that's been continues to be a really encouraging sign. I'm going to throw this in the category of health, in that we need power to live life. And for a lot of these medical advances and all these other things to happen, we need a source of power. And as far as power sources go, what did I read? I think solar power in the next 3 years I think it's supposed to triple in the next 5 years, and within 5 years or so as well, solar power is going to overtake coal as the main source of energy in our world, which is a good thing in terms of clean energy. Also, there's work being done that's really encouraging with nuclear fusion, with batteries, getting better and better batteries, and also with something called green hydrogen. So a lot of good stuff happening as far as power and good sources and clean sources and healthier sources of power. So that's encouraging too. So that's my Bill's year in review. There's a lot of other things that happened from a health standpoint, but I thought those were some highlights that were worth mentioning. So what I want to talk about now, Rebecca's going to tell me what I'm going to talk about now. I think we have a shout out. Yeah. So Deb Nudie has been an employee in physical therapy and does home nursing visits as a physical therapist, and has done that for a number of years. And so congratulations to Deb as our CGH Employee of the Month for January. And yeah, I just wanted to highlight that for ReadyCare, this is different than our tele-urgent care, which you can do online, but actually going to the ReadyCare office, which is downtown in Sterling. We are now accepting walk-in appointments during select times, just as another way to try to get access for as many patients as we possibly can. So you can see the times there that we now have walk-in appointments that we're accepting. And we still do scheduled appointments down there as well. So wanted you to be aware of that. Oh, and then, yes, so the next time that Facebook Live happens, Dr. LeMay is going to be talking about common gynecological surgeries and procedures. And we'll probably delve into just other common gynecological concerns and what the latest treatments are for those. So that will be January 19th. So looking forward to having Dr. LeMay on to talk about that. Okay, that was fairly short and sweet, I hope you found. Thank you for taking the time to watch this. Thank you for taking the time to share this with others, that they can have an opportunity to watch this as well. I wish you and I wish those around you a happy and prosperous 2023. Looking forward to sharing that with you here on Facebook Live. Until next time, thanks for watching.